Leading pediatric organizations are warning of a mental health crisis among teens and younger children, and it's all being made worse by the pandemic. In this week's Mind Matters, Michael Aaron takes a closer look at how to help those who are struggling.
The CDC says emergency room visits for mental health issues increased 31% last year for people aged 12 through 17. That's compared to 2019.
Right now, for our teens, we have a state of mental health emergency.
Dr. Buster Lackey is executive director of the National Alliance on Mental Illness, or NAMI, Arkansas chapter. He says the isolation and anxiety brought on by the pandemic has only made things worse for adolescents.
In the last decade or so, how has mental health in teens changed and the issues that they deal with?
The problem with teenagers is they don't want to talk. They don't want to, they don't sit down and have regular conversations about what's going on in their lives, much less about how they're feeling. Especially when they're feeling something that they already feel is there's a stigma attached to it.
That's why Lackey says it's important for parents to look for certain warning signs.
Depressed mood, loss of interest in their normal things they like to do, not wanting to even, be around friends.
Changes in sleep patterns, anxiety, and panic are also signs of trouble. So how do you approach your teen if you think something's wrong?
You don't walk over and start just saying, hey, you look depressed. Let's talk about it. It won't work, right? But when you can find that common ground that they recognize it, you recognize it, then you can start having that open conversation and figuring out what's going on.
And if your child comes to you asking for help,
I really don't care if you're in the Zoom meeting with the President of the United States. If your child comes to you and says that they're having problems, it stops, and that's 100% focus on your child. And I don't know if we do that enough.
The next step could include talking to a school counselor, finding a mental health professional, or in the event of an emergency, calling 911. Michael Aaron, THV 11 News.